I will eat candy corn.
Oh, you're one of those?
Morning, noon, and night. And I will always eat it in 3 pieces. The white tip first, then the orange, then the yellow. I watched somebody took a handful one day and shove them in their mouth, and I thought they were an absolute sociopath. Okay?
Yeah.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Welcome back to another ghoulish episode of Ask an Audiologist. I'm your host, Kevin Ziener.
And I'm Dr. Jordan.
Of course, it is Halloween this week, and I'm going to task all of the post-production team to drop spiders and have a ghost fly and then have a creepy cauldron over here and
spooky
and make it hauntingly chilling to anybody who is watching. One of the things that can be hauntingly chilly to some people is not knowing why their ears are itchy. And Dr. Jordan is going to help us identify why that is the case, as well as possible treatments. But Dr. Jordan, I have a question for you that is far more important. Mm-hmm. Favorite Halloween candy go?
Ooh,
now,
on the spot.
I ask this, it's not like what's your favorite candy, okay? Now, if you tell me it's a Snickers, I got it. I can side by that. But is there like something that exists in and around Halloween that you're like, that's my thing?
Yeah.
Hit me with it.
Definitely just remembered. The caramel apple suckers, like the
Heck
coated
yeah,
ones.
totally.
The green apple.
Green apple on the inside, normal sucker candy with a caramel coating.
That's right.
Okay. Love that. I think that's a perfect answer. I don't care about this at all. When it's not in the middle of October, I think it's hot garbage. I will eat candy corn.
Oh, you're one of those?
Morning, noon, and night. And I will always eat it in 3 pieces. The white tip first, then the orange, then the yellow. I watched somebody took a handful one day and shove them in their mouth, and I thought they were an absolute sociopath. Okay? But then on top of that, the thing that accompanies it sometime is the candy pumpkin. The little waxy candy pumpkin.
Same way, though. You got to eat the green top off first.
If you're not biting that little nib of green off first, I can't talk to you. Yeah. And if you're eating the whole thing, it's just like you deserve to be haunted for the remainder of your life.
Yeah, that is a spooky person.
Great answer by me. 2 wonderful answers. Now sprinkle candy corn out of my hands right here. Sprinkle candy corn. Great. All right. Okay. Dr. Jordan, for what you actually get paid for. Itchy ears, I get them, you get them. Everybody gets an itchy ear. And I'm sure you could sit here and take an hour and tell us line item by line item why everybody gets an itchy ear. In your professional experience, give me the top 3 or 4 things that are causing people's ears to itch, and then we can get into how to actually treat it.
Yeah. I would say the most common ones are wax in the ears.
Okay. Dry
ears, and probably swimmer's ear.
Okay.
And then probably their hearing aids, or if they're wearing like earplugs or earbuds in their ears, any of that category.
So I'll start at the top. Earwax, one of our favorite subjects, of course, on this podcast. But what about earwax, which is naturally occurring, would cause that ear canal to get a little irritable?
Most of the time it's dry wax that's in the ear. That just cause some irritation. Sometimes if the ear gets completely full of wax and it's completely occluded full of wax, it just causes pressure and irritation in the ears. So yeah, I mean, sometimes wax in general can just be irritating.
Sure. We're saying irritable and irritating. We're spelling it EAR dash irritable. Okay. That's how we're meaning
That's
it.
right.
So the wax can be that.
Yeah.
How does one get a dry ear canal? What does that even look like?
So this honestly is probably the most common, or at least I feel like it is for us. Maybe, I'm not sure. But so often I see people that come in that have dry ears and they are scratching those ears, typically with things that I don't appreciate.
Oh, there are horror stories. There are really bad stories. We were on a trip once and somebody used a knitting needle to scratch their ear and perforated an eardrum because of it. And I said, well, that's awful. It's the worst thing I've ever heard in my entire life.
Yeah. I mean, almost always it's keys, it's bobby pins, safety pins. Like, please stop putting things in your ears.
Just don't do it. They're like, well, this knife was thin enough to fit in there. Don't do it. Please don't do it.
Yeah. They'll have one, a lot of times it's people who are kind of obsessed with using Q-tips, and then they're drying their ears out.
Got it.
So
because it's it's taking out the earwax, but sucking up the moisture too. Yeah.
Of the ear. Yeah. I mean, our ears produce earwax for a reason.
Got it.
And if we're taking that moisture away, well, then now we're removing that barrier of moisture in the ear. Yeah. A lot of times it's people who are removing the moisture out of their ear, making it dry, or sometimes it's people who are just prone to more dry skin than others.
Got it.
You know, they'll have psoriasis or eczema or something like that.
In my brain, then if we go to swimmer's ear, it makes me think it's the polar opposite of a dry ear, which is that there's, a little pink flamingo floating in your ear because there's too much moisture.
Yeah, basically.
Is that really what swimmer's ear is? Is just like sitting water in your ear canal?
Yeah, so, especially in the summer, we'll see quite often kids, things like that, who are just swimming constantly. They come in and then they'll have trapped water in their ear and it just sits in there, causes bacteria. It's just sitting.
Got it.
Our ear canals are dry, damp. Most of the time it's damp.
Yeah.
Causing that moisture to just sit in there, especially if there's a little bit of wax in there too. Well, now that wax is kind of holding all of that moisture behind it.
Got it.
So.
And then just the frequent use of anything with an earbud.
Right.
That will cause some level of irritation.
Sometimes,
I imagine because it's just a foreign body in there for a long period of time.
Well, and then, where I am at, we have a lot of industrial people. So they've got to wear earplugs in loud environments. So every day they're putting those earplugs in. And then what happens is if they do have any wax, well, now they're just pushing it further in their ear. So now there's wax. Or they're using, God forbid, they're reusing some of these ear tips that are supposed to be like a one-time use. But now there's bacteria on it. Or people who are walking around using AirPods 24/7 basically, and they're not really clean, or they do clean them. They'll put like alcohol wipes on there, but it's still wet. Well, now they're putting that foreign body, that foreign substance into the ear canal, also causing irritation.
Got it.
So there's so many factors.
Kind of like a contact issue, right? Moving forward.
Right.
So then I imagine there's not a one size fits all remedy for all of this, but typically, what are the best treatment options if you find yourself just habitually sticking your fingers in your ear scratching?
Yeah, definitely go see your audiologist. If not, your primary care or your dermatologist, any of those things, to find out what is going on, get to the root cause of that. There's something that's causing that. We just got to figure out what it is and treat it from there. Yeah. If it's something like wax, obviously come in and, let's remove that wax and get that out of there. If it's dry ear canals, sometimes I see patients that come in who think that they have wax in their ears. They don't actually have wax in their ears, but they've been self-treating at home. Well, now they've been putting peroxide in their ear, alcohol in their ear, whatever agent that they've been using, which has only been drying their ears out more.
Yeah.
For those patients, oftentimes I will tell patients, using a little bit of mineral oil in the ears, it honestly does wonders.
Yeah.
As long as they don't have any like ear infections that are going on, they know that they have a hole in their eardrum, things like that. Definitely don't use it if that's the case. But otherwise, using a little bit of mineral oil in the ear, every so often just puts that natural lubricant, or similar to a natural lubricant, back into the ear canal.
Got it.
And what will happen is, for some of those people, the ear will actually overproduce wax because it's dry.
Oh, sure.
So then I'll see those patients that come in that just have, chronic excess wax. A lot of times it's dry because they've been putting all of these agents in there, and then they're just stripping the natural oils.
Got it.
So that helps a lot too.
If someone listens to this and they say, "Oh, Dr. Jordan said to put mineral oil in my ear," first off, she didn't say that. Okay, she told you to go talk to a provider first. If somebody, and this is hypothetically, okay, this is not even a doctor talking, this is just you and I talking.
Sure.
If somebody said, "I do want to lubricate my ears with mineral oil," what would be the best way to do that, hypothetically speaking?
Yeah.
Because we are absolving ourselves of anything that looks like liability.
For sure. So what I would tell a patient who has already been in to see me, who we've already been through, X, Y, and Z, we've eliminated any wax, we've talked about all of the things that we need to discuss.
Yeah.
For that patient, I typically tell them to use like a little eyedropper, like a medicine dropper.
Got it.
And just put like a drop or two in your ears. Do it once a week, every 2 weeks, depending on the patient, depending on the circumstances.
Got it.
But that would be the typical patient, what I would say most often to patients that I've already treated, and we've already had those discussions.
Got it. Last question. Favorite costume you ever wore for Halloween?
Ooh.
growing up or as an adult? I don't care. I won't limit it. I'm not an ageist.
I dressed as like a genie.
Okay.
One time. That was a fun one.
That's great.
As a kid, that was fun.
Fun fact about Kevin, hated dressing up. Hated it.
Really hard to believe, Kevin.
Hated it. There is a photo of me that exists somewhere where I am dressed up as Dracula. My mother wanted to paint my face white, as you do, right?
Of course.
And the second she tried to apply it to my face, I started sobbing. She put like a little blood mark in my, like in the corner of my mouth. I thought it was a violation of my human rights. I hated it. As I got older, I would say my favorite outfit was when I dressed up as Guy Fieri from Food Network.
Yes.
And it was honestly one of the greatest things I've ever done. I had a fake goatee.
Yeah.
The night was long and fun. And by the end of the night, my goatee was slowly matriculating off my face and was just flapping in the wind when I talked. That is probably my
That definitely
favorite
sounds more
outfit.
fitting for you.
Yeah.
Yeah.
that-
Can we like insert some pictures?
No,
here?
none whatsoever.
Oh, no. We've got to find some
Not even
pictures.
close. Nobody do anything with these photos. Well, we can't help you with any of your Halloween candies or your Halloween costumes, but we can certainly answer any more questions that you have over at askanaudiologist.com. So we encourage you to go there for all your audiology and hear care needs. And Dr. Jordan, thank you for talking about itchy ears and talking about all things Halloween with us this week.
You're welcome. It was great.
We'll see you guys next week.
Bye.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.